name is Manal Al-Sayed. I'm a professor of pediatrics and director of the Clinical Research Center at the Faculty of Medicine, Ain Shams University in Cairo, Egypt. I'm also a founding member of the Egyptian National Committee for Control of Viral Hepatitis. And I rise to speak for the motion that to win in science and technology, we must Africanize their essence. I rise for this motion in this inaugural African Union Afro-Champions debate series in celebration of the continental unity on the occasion of the Africa Integration Week. Why am I speaking for this motion? It's simply because despite its limited resources, Egypt innovated a model of care to eliminate one of the biggest public health threats that affected millions of our people's lives for decades. Hepatitis C has been ravishing the livers of Egyptians and incurring a huge financial and economic burden both on the country as well as its healthcare system, and also affecting the productivity of millions of Egyptians. How did we do this? We collected data for many years from national surveys, epidemiological studies, and we engaged key stakeholders, starting with physicians associations, civil society, patients' organizations, politicians, media. And this led simply to public empowerment and increased demand. And the government had to respond by establishing a National Committee for Control of Viral Hepatitis, which was charged with developing a national action plan, including management of patients who are living with the disease. A well-established infrastructure with a unique self-financing system was developed, engaging all healthcare facilities and interconnecting them through a database network with patient database. We treated hundreds of thousands despite 2 revolutions and a political turmoil. In 2014, another medical revolution happened with innovation of complete cure of the virus. And this was approved in international markets. The Egyptian government managed to negotiate the price with its well-structured database and infrastructure. They negotiated the price for 1% of the global price. At this time point, Egypt was the only country who succeeded in tackling the problem. In the meantime, the government rejected patency of brand drugs. And that meant that national pharmaceutical companies were allowed to produce their own medications. And we had our own medications, our national medications, with a price that's 1/1,000 of the global price. One of the companies even went further into research and development of novel molecules and also went even further by developing its own raw material. Egypt then could manage to scale up treatment and treat millions, and we made the international headlines. However, in 2018, we started to lose momentum of the program. The number of people registering on the program dropped dramatically, and we realized that there were still a few millions who are unaware of their diagnosis. And to completely eliminate hepatitis C as a public health threat, and to diagnose the millions who are unaware of their disease, and with a presidential advocacy and initiative, we embarked on screening the whole adult population and children above the age of 12 years. In 7 months, we almost screened 60 million people and treated all those who were infected. But we also added other important health issues that allowed the country to have a proper budgeted map of health. We included also diabetes, hypertension, and obesity. One of the key elements for success of this program, the largest screening program in the world, was governance and stakeholders' engagement. What about 2020? Of course, we know that COVID-19 disrupted the healthcare systems everywhere. But also, it offers a unique opportunity not only for Egypt, but also for the whole continent, for capacity building of the healthcare systems, capacity building of technology platforms, and improving awareness with strict infection control measures that could impact many communicable diseases in Africa. Mobilizing the governments to respond to the COVID epidemic or the pandemic would lead eventually to the universal health coverage earlier than the 2030 target of the World Health Organization. What about clinical research in Africa? It has always been a challenge with a small number of registered studies compared to other continents. More than 70% of the clinical studies registered globally are coming either from Egypt or from South Africa. And we need to interconnect our institutions and bridge our institutions and develop a strong consortium and platform for research and innovation. And we can tailor research to the needs of the continent. And finally, again, I am with the motion, as Africanizing the essence of science and technology will cater to the needs of the continent. The ancient Egyptian key of life is in the hands of Africa and should remain in the hands of Africa.